Great, thank you, Chair Lowry, and yeah, welcome everybody tonight. I'm Andrew Scott. I'm a Portland Public Schools board member, and I want to welcome the rest of the PPS board and the broader community to this discussion about schools and COVID. Over the last 9 months or so of this global pandemic, I think what we've come to understand, even more than what we knew already, is how essential schools are to the bedrock of our overall community. I mean, at an obvious level, we know that schools educate the next generation of our children and the next generation. But at a less obvious level, that's become very obvious over the last 9 months, is that our schools allow people to work. They provide social and emotional support for our students. They provide meals and safe spaces and a supportive environment, and really are just a key to the overall well-functioning of our community. Last spring, when we were hit by this pandemic, schools around the world closed. And at that point, little was known about this dangerous new virus. And we switched over, as did almost all schools, to distance learning. After that somewhat chaotic early period, PPS staff and leadership spent all summer of 2020 in multiple work groups planning for a potential reopening in the fall. And the district was prepared to launch a hybrid learning model, come fall, come last September. Given case rates at the time, given that a lot was still unknown about the virus, we did start the year in full distance learning, and we've remained there ever since. Over time, we've learned a lot more about the virus. And there's also been, it's a really unfortunate natural experiment, but a natural experiment that's been happening throughout the world, as some schools have reopened, some schools have stayed hybrid, and some stayed completely in distance learning. I think one thing we know for sure is that there is no clear and simple solution for schools. What we're going to hear tonight is from public health experts who are going to talk about what we've learned in the last year, what we've learned in the last few months, about the actual versus perceived risk of having children in schools, about the impact of distance learning on our children and their education, and about the very real toll that this virus is taking on people's lives in our community. One of our core values at PPS is honesty and integrity, and our belief that transparency is necessary whenever we deliberate and make decisions. So as the board of directors, we want to hear multiple perspectives from students, from teachers, from parents, from partners of the district. We want to know the most up-to-date and trusted information from public health and medical professionals. And tonight's our opportunity to share that information at the same time we're hearing it with the broader community about what we're hearing and what we're learning. And our hope is that tonight will be one of many opportunities to bring about this shared understanding of what we know about the risks and challenges to reopening so that we can chart a course forward. I know I'm really looking forward to this discussion tonight. I know my colleagues are as well. And so with that intro, I'm going to turn it over to Dr. Russ Brown, who's the Chief of Systems Performance for PPS and has been leading our reopening plans for the superintendent. Dr. Brown.
All right, I'm not sure if Dr. Brown is in as a panelist. Oh, there he is. Dr. Brown.
Yeah, on his way.
Perfect. It's really great that Dr. Brown's picture on the slideshow also matches Dr. Brown's picture in the participant list. So there's a good level of coordination there. We're continuing to wait. There we go. Technology, it just takes a minute sometimes. Welcome, Dr. Brown.
Thank you. As Director Scott mentioned, one of our goals for tonight's session is to continue to develop a shared community understanding of our path forward to reopen schools. At the outset of the pandemic, next slide, please. Yes, obviously this evening we have interpretation and interpretation services available for our community. At the outset of this pandemic and throughout this window, our planning has been driven by 4 core principles. As with everything that we've been doing in PPS, we first center racial equity and social justice in any of our decision-making and work processes. then obviously in the midst of the pandemic, we really focused on ensuring the health and wellness of our staff, students, and community, larger community. Beyond that, you've heard us talk a lot about leaning into cultivating and building supportive relationships through this very difficult time. And finally, strengthening and innovating our instructional core as we move through this. Obviously, COVID and comprehensive distance learning have required a tremendous amount of innovation in education over a very, very short window of time. These principles, along with continued focus on data analysis, are what we will share with you this evening, so that we're attending to our primary goal of education while also trying to mitigate the health risks of the pandemic. Next slide, please. So it's always been about balancing education and health as we've moved through this. And from the state, there have always been two primary metrics that we focus on, case rates and testing positivity rates. And for Multnomah County and for Portland Public Schools in particular, case rates have been and continue to be the primary driver for our decision making as we move forward. Next slide. So as we balance those things as we move forward, again, case rates have obligated us from the beginning to open and comprehensive distance learning. And as we moved through the fall semester and we had additional data, we had opportunities to start considering how we could expand our comprehensive distance learning services and afford some focused opportunities for students. And for that, we focused specifically on limited in-person options for early childhood, transition grades, and credit recovery. Each reflects a priority student population for whom we're concerned about their vulnerability to lost learning opportunities. Planning for limited in-person really does capture that tension that exists between the concerns of learning loss and providing for the safety of students, family, and staff. To say the least, planning has been and remains incredibly complex. So, some of the things that we work through are space requirements for our buildings. For each student, each person, we need to figure for 35 square feet per person in each classroom. This is really a substantial reduction in school capacity. And in some cases, it becomes quite a challenge to even figure out how to fit half a cohort of students in a building as we move forward. In addition, we've spent a lot of time looking at building modifications for safety, signage, personal protective equipment, cleaning, relocation of furniture, classroom moves to take advantage of space, having designated rooms for students who arrive with symptoms. And beyond that, and this should be obvious, we had to spend a great deal of time thinking about staffing. The health concerns for staff, health concerns for our students and their families, and all of these things are changes in working conditions, many of which require leaning into collective bargaining to accomplish. And in addition to maintain adequate space between students, it really requires rethinking staff and perhaps even more staff to be able to accommodate safe physical distances for students throughout the day, from the entry process and screening to transitions throughout the day, bathrooms, et cetera. Next slide, please. So in late October, the metrics evolved yet again. And they evolved with the science, and these shifts align very well with our early childhood focus, and again, supporting ongoing planning for the limited in-person activities for transition grades and credit recovery. The promise of hybrid for early childhood is very appealing, but all the challenges of planning actually increase. So all those challenges I talked about for limited in-person, which is only 2 hours a day, expand exponentially when you talk about a school day. And we find that it gets difficult, that planning becomes even more challenging as you increase the number of grades that you include in a building as you move forward. In addition to that, we know that the number of our staff and students will not likely return due to legitimate health concerns. So while we think about hybrid planning, while we're planning for return of students to school, it also necessitates that we plan for those students and those families who are not willing to come back into the school environment until the vaccines are distributed. And therefore, we have to plan for both hybrid as well as remote opportunities for every building in our system at the same time. So again, returning to our guiding principles of centering on racial equity and framing the remaining of the conversation for this evening. There's a clear tension between concerns for learning loss and the health and safety of our students of color. This board is unambiguously focused and set goals to address the opportunity gaps that existed and continue to persist for our students of color. There's a shared concern amongst educators and of the adverse impacts COVID will have, and that those impacts will be, in terms of education, will be borne disproportionately by students of color. On the other hand, our health research and health research around the country has shown that these same communities are being disproportionately impacted by COVID infections, hospitalizations, and deaths. So today, we will open with a discussion of some early research on student achievement and growth changes in a COVID environment. And then we'll transition to a discussion with our health advisory panel. We'll then hear from multiple perspectives of student, a teacher, parent, and culturally specific partner. Both panels will be moderated by PPS leaders with an opportunity for board members to ask questions. If during the course of this evening, you have a question that wasn't covered this evening, we invite you to go to pps.net, which is our homepage, and you'll find a link to our COVID question and comment form, and we'll put together an FAQ to address those questions that arise during this evening. Next slide, please. So we're pleased this evening to be joined by Chris Minnick, who will provide a discussion on student achievement and growth. Chris Minnick is the CEO of NWA, a research-based nonprofit organization that supports students and educators worldwide by creating assessment solutions that precisely measure growth and proficiency. And they provide insights to help tailor instruction. Throughout his career, Chris has worked collaboratively with school districts, state systems, to upgrade assessments and to transform educator prep programs. Chris, we're really fortunate to have him here this evening. He's a recognized leader, national leader in our backyard. He's garnered national attention of policy and decision makers. And specifically in Oregon, as a part of this pandemic response, he's been asked to serve as one of Governor Kate Brown's school reopening task force members. I will now turn things over to Chris Minnick to go through some preliminary research his team's done around student achievement and growth.
Great. Can everybody hear me? Yes? Thumbs up? Somebody? Yes, good. Okay. Thank you. Appreciate it. Thanks for the introduction, Russ. And it's good to be with you in my hometown. And obviously our organization works with like 7,500 school districts across the country. And PPS is one of them. But we've been doing research on how students have been transitioning back into the environment of schooling, whether it be remote or in person. And we have some early data that we wanted to share with you. I'm going to be very brief because I think you have important people coming after me. So I don't want to spend too much time, but I thought I would share the academic data that we're seeing in various places across the country. So next slide. I just have 4 slides that I'd like to go through here. So when we looked at our initial academic data, and these again are based on assessments as students come back to school this year, right? And so this is in the September-October timeframe. So this is not after the teaching and learning that took place in the fall. So I think it's really important to note that as well. What we saw on average was a much bigger drop in mathematics than we saw in reading. And that was not necessarily something that we were expecting as part of the process. We did think that there would be drops in both subjects, but on the reading side, it appears that we've been able to stunt that decline a little bit because of the way teachers and parents have been interacting around making sure kids are in text. It's a little easier to probably give a kid a book or read with your student. So those types of things have allowed us in reading to hang on a little bit more than in mathematics. You see the drops in various grades in mathematics. I will also note about these findings, these are not as large a drops as we had predicted based on our research. So I think the teachers across the country deserve a ton of credit for how they've rallied and helped students, especially early in this school year. Again, we'll look at the data again in the winter and again in the spring, and we'll see where we are. But I don't believe this is a point where no learning is taking place, because that would have been the other projections we had. But there's definitely some learning happening, and it's just not up to the same level as we've seen in previous years. And I think the data backs that up here on this graph. Let me just go ahead and step forward to the next slide, please. This shows the same slide, but we put 1 year on top of the other. So you'll see the patterns in math, which are the group below. So from grades 3 to grades 4, you'll see that the winter to fall growth was much lower than in 2020 than in 2019. But you'll notice in the reading section here, those patterns are pretty much on top of each other with a little bit of decrease. So we saw weakness in the academic achievement in mathematics more directly than we saw with reading. Next slide, please. I think there were a couple takeaways from our analysis, and again, we can go deeper because again, I have a 25 slide deck that goes really into this data. So if you have specific questions, I'm happy to answer them. But I think there are big concerns about mathematics for sure at the earlier grades, that we need to continue our gains in reading. We need to highlight that in mathematics, the unfinished learning that may be taking place across the country, and that's pretty common across most school districts. So we're seeing that pretty consistently. And then it also raises equity concerns. One of the things that we did find in our sample was about 1 in 4 students that we had in the previous year was not showing up in our sample this year. And I think that's a big concern for our students, in that it tends to reflect underserved communities as well. And we can tell based on the socioeconomic status of certain schools that those schools have been disproportionately affected by the turnover of students. So I think that's a concern that we have, and would think that we need to care a lot about those students who have disappeared and then will be coming back to their education whenever we come back into school. I think that's a set of students that we don't necessarily have data on their academic performance as of yet. There'll be an opportunity for us to, as we roll this out, we wanted to share it with Portland Public Schools, but we'll also be sharing it nationally, and there's other opportunities for us to do continued research. So next slide, please. I wanted to just this is my last slide, and I just wanted to recommend to the board that you take a look at a couple of these things. First, I would just point to that you need information on how your students are doing systematically and on your academic side to make sure that you can then intervene, especially in mathematics, where we are seeing a bit of weakness in terms of growth. I think that's really essential. I would also just say the transparency, and Portland has been a leader on transparency in terms of making sure that the data is available and that people can see how our students are doing here in Portland, I think is very important as we move forward. I would also just point education and policymakers to the fact that enrollment might be an issue in a lot of communities. So I know in Oregon, our funding formulas are driven by the number of students. And if we have a fewer number of students this year, the funding issue will become pretty clear as we enter next year. And so what we would recommend from our side is that policymakers are not necessarily using enrollments from this year to drive funding conversations for next year. We think that there will be an uptick in students coming back to education as we get out of the pandemic. So funding formulas are an important thing to consider as we're continuing into the next year. And you'll notice that in the mathematics piece, it's really important that we help teachers understand what students might not have known from the previous grade. You'll see in grades 3 and grades 4 especially, there are some prerequisites in mathematics that are very important, and current grade teachers may not have the expertise or the knowledge to go back and immediately teach those types of things, or maybe not even know that student didn't even get that instruction. So I think what we're seeing in mathematics, because it is so sequential, that there needs to be a focus on that as we come back. And I would also just say, Dr. Brown and I have had this conversation, because reading is less sequential, we got to also be careful that even though the drop isn't as large, that it's really important that as we come back to school, we're focused on reading essentials and those types of things as well. So we have a lot of data to back up this conversation, but I don't want to take any more of the board's time. And I would turn it back to Dr. Brown or whoever's next to continue the conversation. Thanks for your time.
Director Lowry or Chair Lowry, can I ask Mr. Minnick a question?
I think let's, Dr. Brown, are you facilitating this next section?
I'm introducing our next panelist.
Okay,
and Dr. Bird is facilitating.
Okay, so we're gonna have a few more panelists, it looks like, and then we'll come back to questions. Correct, Sharon?
Yes, that's accurate.
Okay.
Thank you, Chris Minnick, and good evening, directors and panelists. I am Sharon Reese, your Chief of Human Resources. I'm pleased to introduce you to our Health Advisory Panel and the esteemed members of that panel who will be presenting next. The Health Advisory Panel was formed this summer to infuse all of the COVID decision making at PPS with, bluntly, people who knew what they were talking about in a pandemic. Being tasked with operating schools safely in first time, or at least first time in our lifetimes, conditions, PPS, of course, recognized that safe operations in the middle of a pandemic was both the most important and also the most difficult factor to achieve. To achieve it, we needed and need subject matter expertise in the medical field regarding this brand new novel virus. It was also painfully obvious that the vagaries of politics and the questionable sources of mainstream and social media were dramatically and continue to dramatically influence decision-making and public opinion. We decided we needed inoculation, and yes, that pun is intended, inoculation from politics and from misinformation coming out of headlines, tweets, Facebook posts. In other words, we needed our own Dr. Fauci. We needed and still need that expertise applied directly to the conditions, the decision-making, the operations on the ground at Portland Public Schools so that we can safeguard our students, our community, and our staff from COVID-19 when we reopen and in our current working conditions. And looking for our own Dr. Fauci in the form of a health advisory panel, we looked for deep expertise in public health practitioners, in epidemiology, in pediatrics, in culturally responsive practices to bring a racial equity lens and health subject matter expertise to this important and challenging work, all while tying that expertise to conditions in Oregon and in Multnomah County. Since its formation in August, we have been running safety questions, concerns, protocols, and so on by this panel, and keeping up to date on the latest info about COVID and health authority guidance in Oregon. Tonight, we have 4 of our panel members presenting. A couple logistics before I introduce them. As you said earlier, Chair Lowry, they will be doing their presentations. Dr. Bird, our Chief of Schools, will be moderating. And at the end, the panelists would take questions from our school board. So without further ado, I'd like to introduce you to Dr. Peter Graven, who is an assistant professor in the OHSU PSU School of Public Health. Dr. Graven's primary position is as a health economist working in advanced analytics and data science. As a data scientist, Dr. Graven builds and deploys predictive and forecasting models. So as an example, Dr. Graven conducted the OHSU capacity forecasting for COVID-19 preparations. How many beds, how many ventilators, that kind of thing. Our next panelist, Heather Godsey, is a registered nurse who works on the lead nurse team at Multnomah Education Service District, more fondly known as MESD, as the nurse consultant for school health services. And she serves on Kate Brown's Healthy Schools Reopening Council. The main function of Ms. Godsey's role as nurse consultant is to serve as the communicable disease liaison between MESD's 8 public school districts and local health departments. Ms. Godsey works collaboratively with the Multnomah County Health Department's communicable disease team to create protocols, communications, trainings, et cetera. Ms. Godsey is a member of the Oregon Department of Education School Nurse Advisory Group. Dr. Simpson, Dr. Joelle Simpson, our next panelist, is the Associate Professor of Pediatrics and Emergency Medicine at George Washington University School of Medicine. She's the Interim Chief of Emergency Medicine and the Medical Director for Emergency Preparedness at Children's National Hospital in Washington, D.C., where she provides strategic leadership for disaster preparedness and community outreach efforts. She leads the incident command operations for the hospital's COVID-19 response and recovery plan. She is also appointed to the Executive Committee of the American Academy of Pediatrics Council on Children and Disasters. Our final panelist, Dr. Tress Goodwin, is also from Children's Hospital in DC. She is an emergency medicine physician with expertise in disaster medicine. She serves as the Assistant Director for Emergency Preparedness and the Assistant Incident Commander for the COVID response in the Emergency Department at Children's National in DC. Children's Hospital, in DC. She's also an Assistant Professor of Pediatrics and Emergency Medicine at George Washington University School of Medicine and Health Sciences. She served as the U.S. Navy Medical Corps for 5 years, including a combat deployment to Afghanistan. I realize that review may have seemed exhaustive, but I can assure you that I've only scratched the surface of the impressive credentials of this panel. I'm very pleased to have them share their time and expertise with us this evening. So with no further ado, I will ask our Chief of Schools, Dr. Sean Bird, to move us into the panel presentation.
Thank you, Sharon. And I'm going to turn it straight over to Dr. Graven, who is going to begin with a short presentation. Dr. Graven.
Excellent. Happy to be here. Welcome, everyone. As was introduced, you know, I'm the lead data scientist at OHSU. I also teach in the School of Public Health. I'm looking at data all day long, and in fact, for the COVID time, I spend over half my week staring at the data directly, having my team work on it, and try to produce a weekly forecast, which every week we're trying to invent, we're understanding new things about how COVID is operating. So I can say if there's data out there, I've usually seen it, and I try to look at it as often as possible. I'm going to show you some of those because I think they're going to be good context for some of our discussion items. It's good to have kind of a base reference of some of the things that I know I'm looking at every day, so you can be there as well. And then we'll go ahead and talk about some of the issues that it introduces. Next slide. So we talked about the case rates being a big part of why PPS, you know, that's the official kind of trigger for opening. And while that's important and that's the key for the from the state perspective, when I think about the pandemic in Oregon, I actually look at hospitalized patients. And so I'm showing you here a graph of the number of hospitalized the census, as we would say, across all hospitals in Oregon. And why is that important? Well, the reality is when you look at people who are in the hospital, it doesn't really depend on testing or patterns that are going on there. If you're testing a new group of people that have a very low probability or high probability, instead you're looking at if people get COVID, if they get sick enough, they're going to come to the hospital. If they come to the hospital, we're going to test them. And so what I'm showing you is the 3 distinct waves that we've had. You can see the first wave where it began going up quickly. We had the stay home campaign that brought it down. Then we went on the second wave when we started opening up our businesses again for around a little after Memorial Day. And that was mostly kind of, that surge was stopped mostly by wearing masks, as it turns out. The summer weather actually helped because a lot of people were able to be outside. And then the third wave, and this one's really distinct. You know, everyone knew we were going to have a fall surge, but it's a lot more, a lot steeper than we had expected. And when you look at the data, which I'll show you a little bit later, this is essentially driven by people doing a lot of the same things. They just went indoors. And it was right when the weather changed, and it's almost as simple as that. Now, so where we are at now, the reason why hospitalization is big is it's a real physical constraint on the system. So you're going to see policy happen when the census gets too high, because if we run out of space, that means A, procedures can't happen, or B, we don't have room for people who have emergencies as well. So this is one of the data points I look at every day. And as you can see, we had a recent peak at 580 on December 9th, or on October 30th or November 30th. And that essentially represents the impact of the freeze. And I'll show you more about that in a second. Next slide. Regionally, you can look at trends. I like to do this as well. Oregon as a state doesn't matter as much as your local area. Of course, for Portland Public, we'd look at Region 1. That's the Portland area, although it goes all the way out to the coast and up to Astoria. But you can see in the recent surge, all the regions have been having a surge here in the fall period. So this is something that was, the statewide policy was quite appropriate when so many regions were experiencing the same thing. Next slide. So the way I think about forecasting, and I'm going to show you a forecast so that you get a little sense of at least a 2-month version of what we look at. And the way I think about it is, how effective is our policy at reducing this thing from spreading at the rate it would absent any mitigation efforts? And so you can see waves over time of how effective we've been, and those have matched to that data I showed you about the census. A couple interesting points is, one, Thanksgiving looks like it's turning out to not be a big increase of the virus rate, and mostly that's because when you look at mobility data, you'll see that people mostly stayed home, and that's actually what we wanted. They weren't at work even, and they weren't even in, shopping or doing other things. Now, we were very worried about meals, and it looks like people took, at least in Oregon, enough precautions to keep that from becoming a big issue here. Unfortunately, one of the patterns you also see is that fatigue sets in every time. So every time we do a policy, people are going to start, we can only sustain it for so long. And so I'm showing in the red dots some forecast points into the future. And what those represent is the policy that we have, the freeze, being somewhat effective, but then gradually kind of waning away. And so I would expect that over the next month. And so that will transpire to increase more infection and more census. Next slide. So unfortunately, the forecast that we have looks something like this, which is, we will see a slide here, and we believe the census would come down a fair bit. But as people become, as fatigue sets in, it's understandable that people are going to start taking chances again, and this is what we've seen before. So whether or not that wave will really go that much above where we are now or not is not as certain, but the odds that we're going to have some people looking to engage in activities again is quite likely. And because we're still in this winter season where any indoor activity is really a recipe for trouble, you would expect the infections to go up again. Next slide. I do have some cool data I'd love to talk to you guys about, but it's a whole bunch of data that measures mobility. So before we get the virus, we see people moving around. And so most of that data comes from cell phones. It's all anonymized, but there's different ways of measuring it. How much are you literally moving around physically? There's a device exposure index, which measures how many people are in a facility that we know the square footage of, so we can tell how close together people might be. There's metrics that look at whether or not you're going to stores, if you're going to work, and just social and distance index in general. All these things are pointing to some clear waves, as I talked about before. The red line here is the thing we're trying to predict, which is transmission rate. And as you can see here, many of these things in the last couple data points went downward. That's what we want. These are reductions in mobility, and they're part of why the freeze has been so effective. But we're going to see some rebound as is natural. And so this is part we're concerned about. Next slide. There's other places that are experiencing the similar restrictions to us. You can see Israel, Belgium, Slovenia have all had big increases. They implemented various versions of lockdowns and then came down. Germany actually turns out to be more similar to us. They had pretty good increase. They had lockdown, but it was light version. And actually they're having to kind of redouble on that right now, but they did not get it to come back down. And in Oregon may be dealing with that situation where we were able to stop the surge, but it's going to take a while before it comes back down. Next slide. Indeed, if you look at our mobility metrics, Oregon is similar to Germany in terms of how much we've responded to the recent restrictions. Israel and Belgium both had stronger effects, and that was evident in their case rates. Next slide. This is a little bit of a speculative thing that I wanted to show you about the idea of the vaccine, which you're going to hear a little bit more about. I do believe, of course, the vaccine is good news and great to have that news today. Here, I'm showing you some ideas about how the age groups that are going to get the vaccine. And while these are hypothetical, the idea is that if, as the vaccine is distributed, these are expected to impact both the transmission rate as well as the severity. If you're giving it to the older age groups that have higher rates of death and hospitalization, we expect that to have an impact on the charts I was showing you. And then I have one more slide, which is essentially why giving it out by age group is really important, because the higher age groups are so much more likely to use the hospital and also end up dying from the disease. You can see 80 plus has a 30% high hospitalization rate per case. That's extremely high compared to the younger age groups. So if you're vaccinating the older groups first, you have the biggest impact on the hospitalization rates. If you believe that hypothetical vaccine distribution schedule, you would get reductions in hospitalization that look like this. And why is this important? Because I believe that this is an important metric. It's going to affect policy and whether or not we're going to be able to either change the metrics that we use to evaluate opening, or to be a signal that it's time to open. Those are the things I wanted to talk about, and I'm happy to take questions after my panel members go.
Thank you, Dr. Graven. And now we're going to turn over to Dr. Simpson and Dr. Goodwin for their brief presentation.
Great. Thank you so much. As Sharon introduced, my colleague, Dr. Joelle Simpson, and I are on the PPS Health Advisory Panel. And it has truly been an honor to be a part of this panel. And honestly, I think we are learning just as much as we are contributing. So we meet every week to discuss relevant topics. We review policies and updates on the status of COVID-19 in the US, Oregon, and Multnomah County. We were brought on to the panel with the main goals of providing medical expertise and also specifically addressing how COVID-19 impacts the core PPS core value of promoting racial equity and social justice. So as we were introduced, Dr. Simpson and I are both emergency physicians in Washington, DC, and we have both adult and pediatric experience. We are both part of our hospital's COVID-19 response team. And we've been working with PPS to translate our lessons learned at the hospital to your school district. We've also helped with ongoing review of your school policies. In addition to the regular weekly meetings, the Health Advisory Panel has held several webinars with PPS. And just last month, we did a walkthrough at a beta site at the Woodmere Elementary School. Those of us on the East Coast, we did this virtually, of course. Next slide, please. So delving into some of the data, a big question has been why focus on trying to get younger students back to school? And this graph shows that the younger children are much less likely to be hospitalized. And we know that even broken down more, the 12 and older age range has an even higher risk than the 5 to 12 age range. In terms of becoming infected as well as infecting others, the older age range that is greater than 12 has been shown to be very similar to adults. We still aren't sure why younger kids seem to become less ill, and thankfully we have seen a very low number of pediatric deaths in this pandemic. But we continue to learn and apply those lessons from the health data to community practices. Next slide. Now we know that the impact of COVID-19 on minority populations has been particularly devastating. The levels of infections, hospitalizations, and deaths have had an outsized impact on Native American, Latinx, and Black communities. And we saw this in stark details in adults. And we have seen the same scenario play out in children. Next slide. And as you can see in Multnomah County, the same disparities exist. That and this slide is excellent. It represents the percent of COVID-19 cases, and it puts it right juxtaposed to the percent of the population. As you can see, the Hispanic population of your county has a very outsized proportion of the cases of COVID-19. Next slide, please. So when we talk about health, it's more than just medical history, allergies, your past surgeries. We always, as physicians, we think about the concept of social determinants of health, and this helps us understand the outside influences that impact health. So I don't know if you've heard of the social determinants of health, but I thought I would define it for you. So the CDC defines the social determinants of health are the conditions in which people are born, grow, live, work, and age, as well as the complex interrelated social structures and economic systems that shape these conditions. Social determinants of health include the social environment, such as discrimination, income, education level, marital status, the physical environment, such as place of residence, crowding conditions, built environment, and health services, such as access to and quality of healthcare and insurance status. So all of these components of the social determinants of health have come into stark reality in COVID-19. We see how these are playing out in the health world, and we know and imagine this is also playing out very strongly in the education system. We talk about the ER as a component of the safety net of healthcare. It's where people can come no matter what. They don't have insurance, they weren't able to see their doctor, they can come to the ER. And it's also when people get extremely ill, that's where they turn to. Well, schools serve as the safety net for so many children. You're much more than education. Schools are where kids get food, they get their mental health care, screening for child abuse and interpersonal issues. To be honest, I had never really thought about how intertwined children's healthcare and elementary and high school education truly is. So both of my parents are actually retired public elementary school teachers, and my brother is a public high school teacher. So I felt like I was a bit of a black sheep doing something totally different by becoming an ER doctor. But in fact, there's an extensive amount of overlap that I never really appreciated until now. Next slide. So when we talk about how can we best mitigate COVID-19, this Swiss cheese model serves as a great analogy. No one layer is perfect. Each has its holes, and when the holes align, the risk of infection increases. But when you combine the several layers, social distancing, masks, good hand hygiene, adequate testing, good contact tracing, your structures have good ventilation, you have clear and consistent and truthful messaging, these all together can significantly reduce the overall risk. And again, through that lens of equity, it's important to realize how, again, these social determinants of health impact these layers of cheese, especially on the shared responsibility portion to the right. So one's ability to quarantine and isolate is significantly impacted by the type of job that you have, your financial situation, your need to go to work, as well as your living situation, such as living in a multi-generational home. So all of these factors need to be acknowledged and worked for at a community level. And also I'd like you to see on about the fifth or sixth slice of cheese there's a little mouse, and that's the misinformation mouse. And as we all know so well in this pandemic, misinformation has been something we've had to encounter, and this misinformation mouse is making those holes even bigger. On a positive note, when we look at that last slice of cheese, that vaccine slice, while it's not a panacea, and as you can see, it only adds one more layer of protection, it is, as of today, here in the US, a very, very exciting next step. And so my colleague, Dr. Joelle Simpson, will take you through some more information on vaccines.
Thank you, Dr. Goodwin. We can move to the next slide. As an ER doc, we tend to work with the punches, and I'm afraid my video decided not to function, but trust that I am smiling behind the camera and very excited to be a part of this panel. So I want to go through a very brief review of the COVID-19 vaccine, and specifically the mRNA vaccine that was recently approved under emergency use authorization. Next slide. So this is a very sciencey slide, but I certainly am going to walk you through the different steps about the science of the mRNA vaccine. Looking in the top left-hand corner, that's the molecule of the coronavirus. You see the corona or the crown of the red spikes, which are the specific spike proteins that are part of the coronavirus. Well, the mRNA, or the squiggly line on the inside, is extracted to make the vaccine, which is the purple circle that's at the top. That mRNA is injected into a vaccinated cell. So when you get a shot in your muscle, the mRNA is put into the cell, and it's then translated using the cell machinery to develop spike proteins. Those spike proteins are then expressed on that vaccinated cell, and your immune system, which is the gray-green cell in the middle, is able to find that spike protein and generate antibodies or build the immune system to respond to those spike proteins. It's not the full virus itself, but it is a part of the virus that's important for your immune system to be triggered so that it can protect itself. Think of it as training your army or your infantry so that when the real virus comes through, your immune cell is prepared and at least knows how to start identifying what it needs to attack. And so you see the last smaller slide where there is a coronavirus molecule. There are antibodies that have been developed in someone who has been primed with the vaccine in order to protect themselves against the more severe impact of the COVID virus. It doesn't mean that it's 100% cure, but it certainly is there to give your body the fighting chance of having recognized part of the virus so that it can attack more efficiently. Next slide. So there have been many questions in the public about the vaccine effectiveness. And when we think about the history of vaccines in this country, we've certainly actually had quite a few successes in mitigating the impact of very severe diseases. Most commonly, we know that kids have usually are required to take the chickenpox vaccine or measles or polio. Those tend to be within a 90% or higher effectiveness range. We're fortunate in two of the vaccines that have come forth, which are the Pfizer and the Moderna vaccines in the US, have shown to be 94 to 95% effective in the preliminary studies that have been performed. And that for us is quite promising. Many of the scientists and physicians and so forth that have been evaluating the expectations of these vaccines that were being proposed really did not expect that, we were aiming for at least 60%. So 94 to 95% is actually quite promising in terms of its potential impact. Next slide. The specific Pfizer COVID-19 vaccine that has recently been approved and is actually being delivered to healthcare systems across the country was tested in about 38,000 patients. And what's really important to know, as we spoke about the sort of health disparities that we see, there was a lot of intention put behind making sure that certain various groups of the population, various racial minorities and tribal citizens who were from tribal nations were represented in the studies to the best that they were able. And there was a lot of recruitment for those populations so that we could analyze the impact of the vaccine. As I mentioned, the vaccine is 95% effective, and it has been reported to have some side effects, but has been in about 4 to 5% of those that have been in the studies so far that have shown some degree of the side effects, which include milder versions of what have been reported in the usual COVID-19 infection. Next slide. Some of the summarizing evidence and recommendations that we have as healthcare providers is, especially as pediatricians, is to note that we are just as excited about one-day reopening school systems. We know that there's been a lot in the media and in the scientific press that children have been at, fortunately, a much lower risk of severe disease from COVID-19, but that risk is not zero. They're still prevalent in numbers across the communities. But the concern in reopening schools is really to be mindful of the fact that kids exist in our communities, right? And they exist under the care of our teachers, the staff, and caregivers, who can be at higher risk for symptomatic and severe infection. So reopening schools absolutely has to take sort of those factors into consideration in moving forward. In addition, what Dr. Goodwin mentioned in terms of health equity, social determinants of health, and any of the barriers that might exist for why people may not get the vaccine or may be at higher risk for getting the infection in their communities, all of those need to be taken into account when planning for reopening of schools. Reduction in community rates, and by that, really adult behaviors are going to be key to reopening. We know that the techniques of masking, distancing, and hand washing, and those hygiene practices are extremely important to protect ourselves. We see time and time again, even in our hospital system, where we have multiple patients with COVID-19, that we've been able to keep our staff safe because of strict adherence to those measures. In addition, the misinformation epidemic alongside the COVID-19 pandemic has been one that has been critically important. And we are quite excited to see that the PPS school system has been really harping on us to be sure to bring forth the evidence in a fair and really critical way. We've been using the CDC, the Oregon County Health websites, and really the professionals in the panel that we mentioned in order to truly be as vigilant as possible in providing accurate information to guide the future reopening of schools, or even mitigation strategies as we do hybrid learning or other measures. So that's the last of my slides. I thank you very much for allowing us to share this with you today, and I would be happy to introduce the next panelist.
Okay, thank you, Dr. Simpson. And just as a reminder to the board members, we also have Heather Gotzi, the nurse from the MESD, here joining us. And now we're going to spend a period of time for your questions to our doctors who have joined us today. So I'm going to moderate this part of the session. So I'm going to start with Chair Lowry, if you would like to ask questions. We're going to contain the questions to the medical part of the presentation at this time. There'll be time to ask the academic questions of Chris Minnick at the end of the presentation tonight. So Chair Lowry.
Thank you, Dr. Bird. I had a question for Dr. Graven about you said that the fall surge was bigger than you had initially expected. And I was wondering what factors you think might have played a role in why the fall surge was larger than had sort of originally been forecast.
Yeah, I mean, I think the big issue here was the impact of weather. And I think we all knew that was going to be a factor, but people really, you can see it. People went indoors and we had gotten used to all these social encounters that we were able to do outside. It happened in every country in the Northern Hemisphere. So like you're going to see it predicted why the Midwest was getting hit harder than us. It predicted why it wasn't so bad in the South. So you would think something as simple as the weather, we should have been able to predict it a little better, but we had gotten really used to this idea of being able to do eating out, even dining. We were able to do that outside pretty easily. And suddenly it really likes to be indoors. We talked about this one meeting, the air changes per hour inside a structure are going to be like 4 to 20 air changes per hour. If you're outside, you're in the hundreds and thousands, right? So it's a really big difference if you can be outside, and that's what we lost.
Okay, thank you, Dr. Vice Chair Bailey.
Yes, I wondered if you could clarify the 90+% effectiveness in the early trials of the vaccines, about what exactly that means. Because when I first read it, I thought, oh, did they give somebody a vaccine and expose them to coronavirus and see who got it? And I understand that it's different. And I think that, I'm a little worried that we get the vaccine and people go, oh, we can do whatever we want now. And that has to do with school reopenings, obviously. So if you could clarify kind of exactly how the effectiveness was measured and what that means for behaviors going forward in the long transition period before we get, and we might have a substantial amount of the population that chooses not to get vaccinated, and what that means going forward as well. Sorry, that's kind of couple of questions embedded in there, but
We'll throw that to Dr. Simpson first.
Yeah, no problem. So the percent of effectiveness is sort of a test of the percent of patients that were in the trials that were able to show that they were had minimal symptoms or reactivity to the virus or mounted an immune response to the virus over a sustained period of time. So certainly those numbers tend to be more robust with more time that goes on. But for the at least 2 to 3 months out from the vaccine, they've been able to show that there has been an immune response mounted to the exposure of the vaccine in some, of the immune response to the virus. And we test that by antibodies, which we have been able to measure. There are different types of antibodies, which are the immune cells that we generate to show that we're able to elicit those in our body from the vaccine. So that's one sort of simplified way of explaining the effectiveness. It is still important, though, that recall that we all have different types of armies in our bodies. So what may be minimal symptoms for one in exposure after being vaccinated could still be a more significant illness for another person. So it is still important to use the mitigation measures that we've talked before in order to protect the general population from future spread. And we see that in time and time again, even with the flu shot. It's not 100% guarantee you won't get the flu, but hopefully it does minimize the symptoms and the effect, and therefore the ability for you to transmit it to others, as well as decreasing things like mortality, hospitalization, those sort of factors that have been a big burden to our society. Does that answer your question?
And I think I also add, just building on that, what we don't know is if that 95%, so 95% of the people that were vaccinated, so of the people that became ill naturally in this trial, they only 5% were the ones that received the vaccine, and 95% were the ones that received the placebo. So that's how they measured it. But what Dr. Simpson was talking about is we don't know if there were some that actually were infected that were asymptomatic from it. So that's really important to understand, is that even if you get the vaccine, we haven't shown that you don't actually become infected and can infect others. So that's why, again, emphasizing that we have to keep up all of those mitigation strategies, is that there's a chance that somebody had the vaccine, then gets infected, is able to shed it without knowing. And how this trial was conducted, they only tested if you showed symptoms.
Thank you.
thanks, that helps.
Thanks. Director DePass.
I don't have any questions at this time. I mean, I have a million questions, but I'll pass for now.
Thank you. Dr. Moore.
Well, I have quite a few, but I'll try to limit it to kind of building on the previous question. How normal will normal be once we get the, a fairly robust rollout of vaccines? So let's assume for the moment that we get vaccinations for educators. So teachers, bus drivers, nutrition, all that. What kinds of measures will teachers and students still have to take even after we get vaccinations? We still going to have to use masks and do all the cleaning protocols and all the rest of it? It's just that there'll be less risk?
Yes, I think until we know that we've reached a critical level, and the number you've probably heard talked about is 70%, and that's when we reach herd immunity. And that number is not going to be reached anytime soon. And we at this point, we don't know enough. I think I can't fully answer because we don't fully know, but that until we have a lot more data, we're going to have to keep doing all of the things that we already know works, which are the distancing, the masking. Once we are able to really target not only the educators, but then the family members of those students who are at higher risk, and a lot of the adults, then that transition to reaching herd immunity, and especially targeting those people that are at high risk for severe disease, that will definitely move us in the right direction. But to come back to any level of normal, what we knew of a year ago, that is a much longer goalpost.
Thank you, Director Constam.
Thanks, Dr. Bird. I think I have kind of a two-part question. I'm not sure who to direct the first part to, but I'm interested in thoughts about the national or international data about rate of transmission in school settings relative to rate of transmission in those schools' communities. And Dr. Graven, we don't have a lot of data on that in Oregon, but the second part of my question is just your take on the governor's current metrics, which I think are some of the most stringent in the nation right now in terms of metrics for reopening and the sort of how universal they are for all Oregon school districts.
Yeah, I can respond at first to that. I think a couple things. It's difficult to know really well about all the transmissions in schools. So we don't have the data set we'd always like to have for that. So that's been an issue from an analytic perspective. I will say, I've done some looking, and there's been papers that have been similar that have looked at, areas that opened in person versus places that opened remote. You definitely saw higher rates of cases in the community. Now, was that related to the schools directly or the other behaviors that are going on? That's always been a very difficult point to distinguish because, of course, you could be open for school and the kids could be pretty safe, but then after you drop them off, what do you go do and what does everybody else go do? And so I think disentangling that has been hard. I will say, I think the recent news that Germany is planning to close their schools is probably a sign that even places that have been very serious about it, when the rates get high enough, it just becomes it's difficult. So that's what I've seen so far. There are some. I think there will be some more papers that will be coming out about impacts of school and whether or not it affects the rates.
Thank you, Dr. Graven. Director Scott.
Great, thank you. I had a similar question to Director Constam, but I'm kind of curious about Peter's last comment. So maybe I'll try and tie them together. So I think one of the hardest public policy things from a school perspective, right, which is what we're facing, is this public health trade-off. And I'm curious from this panel, and first of all, I should have thanked you all for your time. This is an amazing panel, and I really appreciate your time that you're willing to dedicate to the school district and to helping us make really good decisions moving forward. The public health trade-off is this issue of COVID, and we're in the middle of a pandemic. And that's a short to medium term trade-off. And then there's the trade-off that we know happens with lost learning, which is the medium to long-term trade-off, right? And we know that, from just, lost learning results in lower, income, in mental health disorders, increased, suicide ideation, and even shorter lifespans. But often those things are happening 2, 5, 10, even 20 years down the road. What we're dealing with COVID and the pandemic is happening right now. I'm sort of curious from a public health perspective, how do we, or how should we be thinking about those trade-offs, right? And I appreciate the nuanced data and information you've been giving us, because one of the things as a board member, I get a lot of emails from people saying, you have to reopen right away. The data is showing, right, that transmission in schools is lower than transmission in the community, and you're damaging our children if you don't reopen. And I'm getting a lot of emails, fewer, but a lot of emails from people that says, I can't believe you're even talking about reopening. I will never send my child back until there is, full vaccination rates and the entire, community is safe again. And to me, that challenge of how do we gauge short-term risks and costs against long-term risks and costs from that public health perspective is really challenging. So I'll stop and throw that out to you all to respond to.
That's a big question. So I don't think I'm going to be able to give you the satisfying answer you want. But what I can say is, you can think of it as a trade-off. The reality is that I think everybody is on the same side, which is they want to open schools, and it's just a matter of trying to figure out how to do it. And if you can take the precautions you can do to ensure that people feel safe there, then you can do it. And it just seems to be that that so far we've that those are been pretty hard to do. And from either a tactical or feasibility perspective, and also from a community perspective, it is definitely the case that having schools open and a bunch of activities going on is going to generate more community rate infections. So I think that I think there's only one side, which is you want to do it if you can, but finding a way to guarantee that people are safe, both the staff, families, and to the extent possible, the kids. I think, to Tressa's point and others, kids rates are a bit lower, but I'll pause and see who else can jump in here.
Yeah, I was going to say that one of the highlights of my experience with PPS has been the tour of the real life, or at least I could say virtual tour of the school system. I cannot tell you how much I realized that planning for our hospital system paled in comparison to what you have to deal with in trying to keep schools safe for kids. The space constraints in order to maintain safe distancing, the ventilation requirements, the amount of adults to care for a kid that may turn out to be sick and care for them while their parent is waiting to come in to get them. And also just mitigating the anxiety among students in finding out that their friend became sick right next to them and is out of school. All of those elements are extremely challenging. And I think a lot of school systems are that marriage of education need and public health, yes, it's being tormented by this pandemic. But I think from at least our lens in the health world and dealing with a lot now in the emergency department in terms of that mental health impact of the pandemic as well, I worry about the idea of opening a school system that may not have the space or staffing to really support our students, and then have to close down after opening and going through that sort of experience and the impact that could have on schools. When we do our disaster planning, we think about space, staff, supply bottlenecks in being able to execute a safe strategy. And if you don't have the space to get the distancing, the staffing to support the kids, or and by that meaning staffing limited by the impact in community spread, so adults who are affected and can't come into work, and then supplies being the vaccines, then it really is very risky to anticipate opening a school system before those things are in place.
Thank you. Director Bram Edwards.
Thank you, and I want to thank the panelists for your contribution to PPS and our students during some pretty unprecedented times for us. Some of my questions have already been asked, but I have sort of a two-part question. One, are there other countries or jurisdictions in which you would point to as models for PPS to look to in terms of how to effectively reopen and operate school systems? That's part one. And then second, just connecting to this last discussion around the model school, I think you said it was Woodmere, and I know Wilson has been set up as well. As sort of, these are model schools where you build in all the restrictions. I'm wondering if you can state on what you felt the state of readiness was for those model schools. And then a question maybe for Dr. Bird is, where are we in the process with all the other schools? So actually, three-part question.
So
I can answer the model question, the very first one, and unfortunately there really aren't any that I'm aware of. I think, we say, well, Europe did it. Well, they had a very different approach, that they prioritized their education and their kids. They closed down bars. They put a lot of restrictions on public openings that we haven't done here to be able to open the schools. but then now we've seen that they've had to close. And Germany really was one of that great example, and it's in a severe lockdown. So I think all of those, we have to continually reevaluate. And right now, I think we're all kind of in the same boat.
And if I could briefly weigh in, the model school did an amazing job of really looking through Ready School Safe Learners guidance and trying to implement what does this actually look like? How do we make this happen in the school setting? The difficulty, of course, becomes, as Dr. Graven pointed out, people tend to sort of lay off a little bit, right, and get tired of being in a pandemic. And they're looking for that magical thing, like hoping that the vaccine is going to be the key, right, to returning, where I really feel like we need to continue to focus both our staff and our student families and our general communities on helping each other understand and hold each other accountable as well to continually practicing those preventive methods that we know work, right? Following what public health is sending out, not gathering in enclosed spaces that don't have good ventilation, making sure they're wearing facial coverings. And the social distancing seems to be a continued message that we need to continue sharing with our families and staff. Because of all the positive case investigations that I've done so far, not only for PPS, but all of the other MESD component districts, we're really seeing that people don't understand that spacing, right? Of even if people you are hanging out with do not appear ill, maintaining that at least 6 foot distance is imperative, not only for your own mitigation of risk, right? But also to make it so that you don't end up being a close contact to that positive individual and having to quarantine. And we've already seen situations in the work setting where we end up identifying close contacts and having to quarantine an entire, staff group, whether it's nutrition, custodial, things like that. And if we're dealing with that already while we're not having students on site, we can already see that that type of communication is going to be essential, and repeated communication, right, around those preventive methods, balancing that against the fatigue that everybody is dealing with, right? The pandemic fatigue, the notification fatigue. So PPS will continue to work behind the scenes on how do we provide good trainings, not only for staff, but for our families, and balance that out with not creating more fatigue with families that are already dealing with trauma.
And then Director Brima, we're to answer the question about the school's readiness. So our facilities team has been working for the last several months to do what they did in the model school sites at all of our schools. And we'll be taking our principals in the month of January to visit those sites. But now we have sites across the district that are ready to go once we have the once it's safe to do that. So principals also participated in that process with facilities, but really a big shout out to Dan Jung and the facilities team for going through all of our facilities across the district to do that.
So
and we have time.
Just to clarify, when you say that you'll have facilities across the district, does that mean that all schools will be at a certain point ready in January or February?
They're finishing up the final schools. Yeah, they're almost, I think they're within 2 weeks of completing the. Awesome. They've been working for several months though. It's been a long process for them.
Great. Thank you.
And I don't want to leave out. We have a couple minutes before we have to transition, but I want to make sure that we ask Student Representative Shu if he has any questions for the medical panel.
Yeah, thank you. So as I understand it, we have yet to see large-scale trials of the COVID-19 vaccines among children, and particularly younger children. I wonder what kind of trials we need to see take place before we can feel safe administering any kind of vaccine to children, and how long that will take to complete. And as an extension of that, very roughly, when can we expect for a considerable portion of our student body to have access to a vaccine?
And that's an excellent question. And as a pediatrician, we get asked that all the time. It's not uncommon for kids to be put into trials after it's been tested in adults. Kids have very different immune systems. They're often challenged very differently. Their immune systems are a lot more naive. So there is a push for children to be included in the trials in this upcoming year, certainly. And they've already started enrolling kids and doing outreach in communities to get kids enrolled into the studies, as well as pregnant women, by the way. So certainly we're hoping to have some data. I would hazard a guess by the sort of mid to late summer, that would be insufficient volume in order to make some statements about the safety of the vaccine in children, and possibly even earlier than that. But latest possible guess would be summer to late summer.
Great. Thank you, Dr. Simpson. Thank you to all of our doctors and to Nurse Gotzi for your presentation tonight. I want to turn it over now to David Roy in Communications, who's going to take us to our next panel. David.
Thank you, Dr. Bird, and good evening, everyone. I'm David Roy. I'm the Senior Director for Communications for the district. And as the communications person, I would reiterate what Dr. Brown said earlier, and that is if anyone who's watching on our YouTube stream has any comments, or if you have a question that doesn't get addressed tonight, please go to pps.net. You'll see a big banner at the top of the screen of our homepage. And there you'll have a link where you can leave us a question or comment. We will definitely see all of those. So we invite you to do that. It is my pleasure to kick off the next part of the evening, which is a panel discussion with folks representing some of our most important stakeholder groups, including students, parents, educators, and our community-based partner organizations. Our moderator will be Jonathan Garcia, our Chief Engagement Officer at Portland Public Schools. And our first panelist is Lana Paris. Lana is a senior at Cleveland High School. We've gotten to know her as a student activist leading Portland's and Portland Public Schools efforts to elevate climate justice and climate change education. And Lana is mere days as we speak from knowing where she will be attending college next year. So everyone have a good thought for Lana, not just for the news that she's going to get, but for her nerves right now. I'm sure she could use the moral support. So thanks to her for joining us during a really busy time. Our second panelist is Angela Bonilla, an instructional coach at Scott Elementary, an educator for 5 years. Angela has been at Scott for 2 years. And when she's not on campus, as our teachers are with the youngers right now, teaching virtually, she keeps herself busy with a number of things, including working on a really exciting project around a virtual tabletop role-playing game. And she told us a bit about that today. Our third panelist is Dr. Catherine Rodella, mother to Rudy, a 4th grader at Lent K-8. An educator herself, when she's not golfing with Rudy, Catherine is a tenured professor at Washington State University. And our final panelist is Tamara Hickok, the Director of Youth Services for Self-Enhancement, Inc. Many of you know that SEI provides culturally specific services at many of our schools in Portland. I employ a whole school model of programming. And something about Tamara is she's a proud Jefferson graduate, and she still cheers for the demos in a household full of Grant generals. So she's got a house divided, but all put her arms around her fellow PPS high school. So many thanks to all of our panelists this evening for taking the time to be with us. And I will now hand it over to Chief Garcia. Jonathan.
Thank you, David. And then we can take off the screen and just go to screen or the all TV. There we go. I see Lana. I see Dr. Rodella. I see Miss Bonilla, and I think I'm looking for Tamara. Awesome. I see Tamara. All right, so let's get started. Hi, everybody. Again, Jonathan Garcia, Chief Engagement Officer. Good to be with all of you this evening. So we're going to get started off with Lana. We'll start with our student here. So first of all, so for everybody, what wasn't in her resume is that, or in her bio, was that she's also a student intern in my office. So really, really, really jazzed that she lends her voice in many ways here at the district. So Lana, how are you? First of all.
I'm good. Hi, how are you? I think, yeah, I'm doing well today, a little anxiously. I think this might have been mentioned, but a lot of college decisions are coming out this week. So that's definitely nerve-wracking.
Yeah.
Go.
So just, yeah, can you tell us a little bit about your school experience? And then, you just heard from a bunch of doctors and nurses about, information and all this data. So what do you and your friends hear about COVID, and where do you get your most trusted information? Share a little bit about where you get that information, and what does the info that you see tell you about reopening?
For sure. So my school experience this year has definitely been difficult. I think it began with there was very little streamlining, I'd say, of the way that teachers were told to do things and take attendance and give work and all that. And I think asynchronous led to, or like lack of synchronous time may have led to overcompensation with homework. So that was difficult to adjust to. I know my friends and I specifically, we get our news a lot from Apple News, which is just an app you can get on your phone, and it generally gives notifications from major news sources. I prefer the Washington Post myself. And my friends, actually, my friend group particularly, there's a popular reporter on TikTok, which is like a very famous or new social media platform. And his name is Marcus D. Paula. So he posts things around 2 to 3 times a day, and a lot of our COVID information actually comes from him. But yeah, so with that information, we've actually been kind of guiding ourselves along the way. So this summer, my friends and I had a pod, which was my and just those households. I think it was easier to do along the summer, as the medical professional said, we could spend time outside and, you know, generally be okay with just sunshine and having good times together, especially when school wasn't a thing. But as cases began rising recently, we decided to close our households off once more. And we made that decision based off the knowledge that cases had been higher than ever. And I personally have had the experience of having a family member with a health condition, especially had COVID-19 at the beginning of the pandemic. And this kind of ensured that I was pretty careful about the precautions I took about it. So in the end, I think we've all pretty much reached a consensus that if schools were to reopen, I'm sure we would all choose to stay virtual, just with the knowledge that cases are pretty high. We all have pretty high risk family members, and as long as student lives and teacher lives and all the families and other care workers are at risk, partaking in hybrid schooling, just to me and my friends at least, would seem kind of an irresponsible choice on our part, especially with the knowledge that the pandemic does have the potential and does actually affect BIPOC and lower income communities the most. And as somebody who identifies as BIPOC and lives in a lower income neighborhood, this is pretty important to me. So I hope that answers your question.
That was a wonderful answer. I really appreciate you getting us started. So I'm going to turn it over to Ms. Bonilla, one of our incredible educators here. So how are you following the latest data? Are you looking at Multnomah County? Are you the state of Oregon, the CDC? And then does the change in trajectory here in early November cause you any concern that you might not have had before?
Yeah, well, I first want to thank all of y'all for starting with a panel on the data, because I think that's one of the biggest stumbling blocks. We have a lot of those little misinformation mice going around. And so I really appreciate that being put at the forefront. I get a lot of my information from COVID Act Now. I get emails from the New York Times. We also talk a lot as teachers about the data that we're hearing from multiple sources and sharing with each other, because there's always that concern. Are we going to have to go back? Are we going to have to make a decision about whether we have to expose our children, our family members, and will we have enough notice to make a choice? So I think the change in the trajectory of the numbers has really affected that sense of insecurity, where educators want to make sure to give their students consistency. And the idea of possibly going back, and what if, you know, numbers surge and then we have to go back to digital online CDL learning, is still very much at the forefront of people's minds. So I think personally, you know, there's always that pull, that want of, I want to be in front of the kids. I want to be able to give them the kind of education they deserve, you know, but we also don't want to send kids home so that they can injure their own families, so that they can expose their own families. So it's definitely a tightrope, but the new data is really making us worry about that January 28th deadline.
Yeah, I appreciate you sharing that, Ms. Bonilla. And Dr. Rodella and I spent a little bit of time chatting this morning, and I think I think Dr. Rodella has a little bit of insight here as well. So Dr. Rodella, I know parents like teachers and students very much want our schools to reopen. Do you have any reservations? Do you have any reservations? And then kind of what data are you looking to help guide your household decision-making?
Thank you, Mr. Garcia and everybody. And I really also want to reiterate, I appreciate hearing from the medical experts who have been looking at data. I guess for me, one of the first things I actually appreciate that the district's using case numbers. But for me, particularly as a Latina mother and raising a multiracial Black, white, and Latino young man who goes to Lent school, which is over 50% Latinx students and majority students of color, over I think about 36% teachers of color. I think a lot about the case numbers by race and ethnicity and the disproportionate impacts on the Latinx population. I think for me as a parent, the question, it's not really a data, but it's almost my urging to the board and decision makers at Portland Public Schools is about this question of, whose voices will drive decision making, right? Obviously, data is really important, but which parent and youth voices matter the most? And so we had, a board member, director mentioning getting these emails, and I always think about which parents feel comfortable sending an email in English and feel entitled to do so. And I think about the parents that my son goes to school with who often feel like their voices don't matter, and they're also the ones often most impacted by COVID. So I have people in my family who have got COVID, who have also been, people in my family who've been hospitalized. I know people who have died. And so to me, that is something that I tend to see some of my, and I'm a professor, I have all these other privileges, I've been well educated, and some of my wealthier white friends who don't know anybody who's had COVID. And I'm trying to say, please, like, once you know and have this personal impact, it really changes your life. Another piece of information I think would be really helpful in my decision making as a parent is not just like, okay, what are you going to do to make schools are safe, but also how are we going to protect and think about educators, particularly educators of color. So I'm a professor of education at Washington State University on our Vancouver campus. A lot of my students are actually educators and administrators across the state of Washington, and several of them are in districts where their school boards basically said, we're not going to listen to our county governments. And our public health officials. We're going to open schools regardless. And what we've seen is, or we're going to do hybrid models despite growing case rates. And that's been in more conservative and rural districts. And what we see are the teachers are completely strapped. I have students on my classes, educators who are crying, who are overwhelmed, who are trying to juggle hybrid models without support. And so every time I talk about how my son goes to Portland Public and we decide, Portland Public right away decided this is the date, we're going to go to January, that it allows this ease for educators to prepare, right? And so I think about as a parent, even because I want my son's teachers to be supported too. And so those are the pieces I think about. I also think about how, I'm worried about him falling behind, but I'm more concerned about the stress around him feeling like he's going to get sick, or the other kids could get sick, or family members like his grandparents could get sick. So I think about the human side of it too, and what's best for him and his well-being and welfare, as well as other students, of course.
Thank you so much, Dr. Rodella. And Ms. Tamara, you're going to close out this panel. Time for one, and then we'll turn it over to the board if they have any questions for any of you. But Ms. Tamara, tell us how SEI, who is one of our greatest partners here at the district, is gathering data and information about student and family service needs to inform your organization's approach to reopening.
Right. Good afternoon. Well, this is evening time, everyone. Almost dinner. Well, if you're in our house during COVID, dinner is like around 10:30 because we're all confused. So it's good to see you guys, and I'm honored to be on this panel. A little bit, hearing so much today has just really been eye-opening. As I just received, I don't know if you can see me on my phone, I apologize for just received notice that my daughter's roommate just tested positive. And she's a college athlete in Utah, where at one point they were at testing over 100 cases a day. 1,000 cases a day in Utah. And so that's where my daughter is. And it was just like, okay, that just, and listening to this information kind of really shocks you into reality if you haven't already been. A little bit about SEI, what we're doing right now in order to gather information around our students, in one word, we use relationships. But in order to kind of quantify that, we look at how we can spend the time with our kids during this moment and still make sure we're satisfying their needs and getting to what they need. So strangely enough, the data that we use, some of the data that we use was actually pre-COVID data. And that pre-COVID data, say for instance, at one of our studies at Jefferson High School showed us that many of our students were going to school at the same rate attendance-wise as their counterparts, yet they weren't performing as well academically, showing us just how important social engagement was for our students. And so one of the things we looked at quickly as we were able to pivot into this moment is how do we keep our kids socially engaged in a way that we don't lose them emotionally? So what SEI did was we took our relationship model and we looked at 5 specific things as we had our coordinators check in with 10 students every single day, 10 of their students every day. By the end of the week, you talk to every one of them. And the things we look into were home safety, food security, emotional wellness, academic resources and objectives, and then lastly, their individual success plans. Using that information, that data was fairly, I guess you would say it would be raw data because we're actually having them track this information while talking to students and immediately acting upon that information. We were able to pivot pretty quickly, and instead of not being in the building as we're used to, we were able to pivot and do our stuff virtually. And that includes, most importantly, our online classes, our online groups, presenting them with still leadership classes, gender groups, and all those things that our kids had become accustomed to and felt like it was quickly separated from them. And so we would use that same information based on the data, knowing that social engagement was so important, we were able to keep our kids engaged. One of the things I wanted to also mention was we use the comparison data, using comparison data of engagement of some of our PPS students that are not in SEI versus our students, and showing that our students are performing at a rate, are engaging at a rate much higher, simply because in their classroom, PPS has allowed us with synergy access and our ROIs to be in the classroom with the students. And they're partaking, and the teachers are allowing us to participate as well. And I think some of the teachers have actually been like, thank you for being here, giving me a second to take a deep breath, because we can tell this weight is heavy on everyone. One thing that, I just wanted to say was we often think about the weight of the virtual learning on the student while they're in the classroom. But one thing that we've been focusing on as well, and how we service our families, is the weight of the virtual learning on the family. So if you have 1 or more students who are on the laptops all day, that means that's an hour, 3 hours, 4 hours where the rest of the family might have to be quiet because I don't have a separate place to sit in my home for you to be able to be on your laptop and I can be over here. Oftentimes, that time also is time that our students are separated from their families. And so one of the things that we've learned is trying to get students not to see their laptop and classroom time as the enemy to pull them away from families, because I'm on my laptop, I can hear you guys over here laughing, having a good time. Do I have to choose? So a lot of our work has been around making sure, especially socially, emotionally, that our kids are intact, our kids are whole, but most importantly, that our families have what they need in order to not have to worry about, if I'm not here, then something else is going to be missed. And so a lot of the data that we've been using is participation of our kids, participation in our social events, participation in attendance in classrooms, participation while in the classroom, as well as making sure that our kids are attending the social activities that we provide for them in the afternoon and sometimes on the weekends. Just doing our best to keep them as engaged without trying to burn them out, as well as over inundating the family with all this technology in their house all the time. Because we also got to remember, with all this, their bills increase, right? That's an easy data. We have the numbers on how many families we've had to provide with energy assistance, how many families we've had to provide with food services, because we're used to kids getting 2 meals a day at school. Now they're getting 3, 4 meals a day at home. And if you have student athletes and football players, they're getting 8 meals a day at home because the refrigerator never closes. So we just know that there's just day-to-day things that when you talk about data, day-to-day things that have changed just the daily existence of many of our families.
Absolutely. Thank you, Ms. Tamara. Actually, before I turn it over to the board for any questions of our panelists, I do have one question for both Ms. Bonilla and Lana, which is, and you heard this from our doctor panel earlier, we are going to come back to school at some point, right? So what are you most looking forward to when schools do reopen? And Lana, maybe we start with you.
I don't know if I would have my last day of school or not as a senior, but on the off chance we do go back, or should I say lucky, on the chance that we do go back, I really look forward to seeing my favorite history teacher and sitting in her classroom again.
That's awesome. Thank you for sharing that. Ms. Bonilla?
Yeah, I think what I miss is the physical proximity and body language you get from working with kids. And I miss the little routines and the little side conversations you have when kids are walking in line and something comes up and they got to tell you. I miss, so I'm looking forward to hearing that oh sound again, as opposed to it being asynchronous online by themselves at home. So I'm just looking forward to seeing the kids again.
Thank you for sharing that. Directors, I think we have time maybe for a few questions. And maybe I'll start off with Director DePass. I see you're unmuted, so maybe you want to start first?
Yeah, I did. I wanted to thank the panelists. It was really great to hear from you, your perspectives. Dr. Rodella, I echo, and in fact, earlier during this conversation, made a comment. I was concerned about the families that we are not hearing from. Having worked with the Portland Housing Bureau, I know that we have immigrant families and refugee families that are looking for apartments that can sleep, 9 people, 11 people. And I know that we have families that are crowded in crowding working conditions, and the language barrier is difficult. You need to be comfortable writing in another language in English if it's not your native tongue. I wonder, of all of us on the call here tonight, who would be comfortable writing a letter in Spanish or Chinese or Russian, and how you would do that if you were living in those places. To Ms. Bonilla and Lana and Ms. Tamara, I really thank you for being here. I do worry about our communities of color. We don't hear from them. We don't get the emails from them. I worry about the transmission rates, the proximity in rental apartments, and it's a big concern. I know there's a loss in social emotional learning, in academic learning. I just feel like we can overcome some of those things, but we can't overcome those things if your grandparents aren't alive, if your parents aren't alive. And it's a really big concern of mine. Thank you so much for joining us. I really appreciate you all.
Thank you, Director DePass. Does anybody want to share any comments to what Director DePass shared?
Señora
Bonilla, por favor.
Claro. When we came back in August, we did a professional development session where we read an article that was actually sent through PPS about how the pandemic, as awful as it is offering us an opportunity. It's offering us an opportunity to see the world through a new lens. All the things that seemed impossible before, we made happen, right? Like kids who weren't getting, who wouldn't have gotten fed are, programs like SEI are supporting them. You have teachers dropping materials off at kids' homes, schools organizing drives to ensure that every kid has what they need at home. And so I think the concern about going back is that we're going to try to go back to a normal that can no longer be acceptable. So this pandemic has really shown us that schools are those community centers. They're those community hubs where a lot of services outside of just education and instruction happen. And so what is our society going to say and do once we do come back? Are we going to get the resources and support and things that we need to continue to provide those services at that level? Or are we going to pull back and say, well, now that everyone's in school, we can go back to work. Everything's fine. So I agree with the previous speaker. I think we need to, as a district, as a state, really take the time when we're considering going back and thinking about what systems have been created by all these innovative educators and administrators and students and families that we need to hold on to and put our money and power and time behind.
Jonathan, this is Director Constam. I just want to chime in, Miss Bonilla. Everything you just said is absolutely pure gold. We really need to challenge ourselves to figure out how to hang on to the best of what has come forward in this time. And Ms. Hickok, to hear you going through like all the activities that SEI is doing with individual students and really taking the temperature of each individual family and figuring out what their needs are and how we, in the broadest sense, we can make sure they get met. I really think it is an invitation for us to up our game as a community to figure out how to collaborate on all the supports that our families need. And, our old Mercy Corps motto is "In crisis lies opportunity." So I think what you both have highlighted here are incredible opportunities for us. And also, Lana, I just want to say for the kids, I know a lot of kids have experienced some aspects of remote learning that are, kind of okay in a lot of ways. And for some kids, even better. But still, I just want to acknowledge, just the loss, all the loss and sadness and isolation and missing your friends and missing the rituals that you associated with your senior year in high school. And I think because we're all in it together, our students have just showed amazing resilience and just positive attitude and perseverance, but still, it's just a lot of heartache and loss. And I just want to send that out to you and all your friends on those tough days. We feel you.
Appreciate it, Director Constam. Any board members, we're actually going to go to 7:55. So if you have any questions, any insight that you want to hear that you haven't heard from all the emails that you get or all the Facebook groups that you're a part of, what are the things that you're not hearing that you want to hear from? We have 4 amazing panelists here. Love to have you share, ask any questions, get any additional insight.
I have a question. First, thanks to all the panelists. And this is for SEI. And I'm just wondering whether among the community-based organizations, whether there's any sharing of sort of best practices or what's working. We're all in sort of unprecedented times, and the normal strategies that we use don't necessarily translate. And so it sounds like SEI has adopted some that really are engaging students, and the data is demonstrating greater engagement. So I'm curious what sort of collaboration or sharing of new practices is occurring.
That's a great question. So one of the things that we did quickly is SEI is known. One of the things we're known for is our 6-week robust summer program. Well, this year, since it was done virtually, we were absolutely able to open our summer program up to our entire community, people not necessarily close in that would normally not have access to our programming. And so we had summer programming this year for 6 weeks with over 100 classes, grades from elementary all the way up through senior and high school that kids participated in. We had students from Wrigler, and I'm trying to think of some of the schools right off the dome that aren't SEI schools that had access to our classes. Some of the ways that we collaborated with other CBOs is we work with a lot of the other programs, Latino Network, MFS, NEA, in doing some of our food banks. We collaborated on those. We know at King, for instance, King Elementary School Martin Luther King Elementary School. The first week we served around 150 students at the food, giving away food boxes. Within the third week, that number was over 300. So we know that as we continue to partner and send that information out to other agencies, we were able to partner and collaborate and keep everyone safe. We figured, the smaller, the more we would combine our services, There'd be fewer places for families to go, fewer places in the community for people to try to go around to get other services, and we could provide them in one stop. We continue to do that. We're also collaborating with other agencies, just showing how to connect with students and use Instagram, how to record phone calls, video calls. Some weren't aware of the Google Meets and how to use it. Definitely training other managers on how to use smart sheets and just different things that we're working with other people to use. Just anything that can help you get to kids more quickly, more efficiently, and most importantly, how to connect with parents. One big thing that we use is a lot of people hadn't worked on their application process. We're still trying to figure out how to get those out. And we were one of the first to start with the DocuHub and showing people that you can still get signatures and it can still be, legal, as opposed to having someone sign it for you. We were used to get your ROIs done. So we kind of shared a lot of those practices with other agencies.
Thank you.
Mm-hmm.
Yeah. Any other board members with a question? I see Dr. Moore looking to ask a question.
Thank you. Thank you to everybody who's been here tonight. It's been really a great session. I do have a question. I've heard some stories from various families about kids who are actually maybe not thriving in the current distance learning environment, but actually doing better. And it's often kids for whom, usually high school students, and they're not doing especially well in the comprehensive high school, and they're really finding this distance learning works for them. Are you seeing that? I don't know how prevalent this is, but there might be something there might be some practices in there that we want to continue in the after times.
How about Dr. Rodella? Maybe do you want to start as a parent, and then love to hear from Lana, our student, and then Senora Bonilla, our educator, and then we'll finish off with Tamara. I think that's a good question to round out this session. Dr. Rodella?
Yeah, I think about, I guess to me, I want to credit, I feel like my son is a little bit like that in some ways, that he's really, he's enjoyed it, but there's also this cost of he really misses being around other little kids. I know it because he tries to tell us all about his Lego Ninjago, and I really can't handle listening to any more about that. I'm losing it. But, I think about the social aspects and how that can be. So it's amazing to hear about SEI's work in terms of that and creating those social aspects. But I also think about the joy he has every morning. They do a quick meet with his wonderful teacher, Maestro Kevin Zapeta from Lent, who I'm going to give a shout out to, who, they did something after they all did well on some assignment, they got to have a movie day, which is they're already in front of a screen. So part of me was that seems silly, but that was really helpful. But I do think there's this tension around how, I guess I don't really have, I do know that for some families, it's just much more burdensome, the number of children and the amount of assignments. So even my child, who's the child of a professor of education, apparently had missed 15 assignments, and I was horrified because I couldn't keep track of it because I had all my job. And so it's just those things. But I also know that his teachers have been really understanding, and there's no high stakes. But he's also at 4th grade level. So I guess that's kind of my perspective as a parent. And I think I have heard from colleagues who work with Black families who talk about their children feeling, who might be in more white dominant spaces, feeling like they don't have the same microaggressions all the time, and they feel better at home and safer at home. So some of the narrative that comes out of educational research, which is my field, about how all these kids are failing and doing terrible, is maybe not for particular groups of students who are no longer in these places that have been actually really aggressive for them. And that also I've seen people have talked about from a research standpoint for LGBTQ students too, maybe not having to hear some of the same kind of offensive language and types of bullying. So thank you. That's a good question.
Lana?
So I think I can't really talk for other people's experiences so much as my own. So I think I'll just go with my own. My own experience as a student is that it's been a lot harder with virtual learning, just because I know that huge portions of my grades in a normal year actually do come from my interactions with my teachers. And it doesn't seem like they would, like from the actual like percentages of grading, things will come from assignments, tests, things like that. But when it comes down to it, the being able to talk to my teachers face to face and like choose to go see them when I choose to go see them greatly affects my grade every year. And it's been a lot harder this year to keep my grades up, and I'm a 4.0 student, so I would say in past years, just being able to like keep that and keep my grade average up has been for being able to go talk to students, not to talk to students, talk to teachers, and develop a relationship with them. It's just so much easier when it's more at my control, if that makes more sense. Virtual learning just lacks that kind of control. It's very regimented in that sense.
Yeah, appreciate that. Señora Bonilla? You're on mute, sorry.
Thanks, didn't fully click. There are some students that are doing well, but as an instructional coach, I observe a lot of different classes, different grade levels, and talk with a lot of different teachers. And the common thread is that those students who have support at home are the ones doing well. Even from my experience last year, I had students who struggled in the classroom with attention, lagging skills in their attention and other things that as soon as we were online, they were in every session and doing every assignment because there was someone at home who was able to give them that one-on-one attention that we couldn't provide in the building at all times. So I think, you know, it's definitely a certain demographic of folks with specific privileges that are benefiting and still doing well. And, you know, some of these practices are things that we know can work, like flipped classrooms where you give kids a video to watch and then you can spend the time actually working with students at their level so they can go at their pace. Those are things that's something I did when I worked with a 6th grade self-contained class. Those things are possible when we get back into the building. So we don't have to necessarily lose that benefit from kids that kids were receiving. But I also know that kids that I didn't see all spring after reaching out, after dropping off Chromebooks at their home, I didn't see them all spring and they weren't here in the fall. It took a lot of work, a lot of home visits, a lot of phone calls, a lot of just effort and energy from the school, from the teacher, from the administrators, from our climate specialists to get those kids back online. So, and that's one student I'm thinking of was also, you know, receiving special ed services, was also receiving English language development services. So all those pieces are still falling to the wayside for a lot of our kiddos. And I think the other piece that I think Dr. Rodella talked about is that affinity that kids get to build with each other and with the adults in the building. And Lana also talked about. I'm usually, for a while, I'd be like the Black teacher at schools. So Black students would find me that I had no idea where they came from, which class, which grade, but they'd find me and they'd look at me and they're like, whoa, who are you? And I introduced myself. And so there's an affinity that was created where those kiddos would see me in the hallway and we'd see each other and we had that kind of connection that's gone. And now that I'm not in the classroom, that I'm, you know, an instructional coach, usually my role would be walking around the building, supporting students and teachers, walking into classrooms, doing observations. So I would have been able to hopefully connect with even more students, and that's not the case. So I think there are students who are doing well, but I think we need to remember that institutionalized barriers still exist. And as the educators and the board members and the administrators, we are the institution. So we can decide how we're going to amend these practices in order to benefit those who have been historically underserved by these institutions. So that's, you know, those are my 2 cents on student achievement during those times.
Awesome, really appreciate it. Ms. Tamra.
Yes, I can't even imagine what I could add that has already been so eloquently said. Other than I would just say that, you know, as much as I want to believe in my whole heart how many kids are doing so well at school, I mean, doing so well at home now because they're not in school, and I can't help but think of the other side of self-enhancement that deals with how many kids in the uptick in domestic violence that kids are experiencing in their homes, and the uptick of, you know, being at home and the stresses they used to get away from to go to school. they're there front and center. So one of the wonderful partnerships that I think that SEI and PPS has is that wraparound of a kid. So normally where they would be at home, and now this is a stressful time, once their school learning is done, we're able to have those conversations with their coordinators. Sometimes it's late into the evening until I can go to sleep, you know, just staying busy where they would normally be at the center and someplace away from home, staying busy until they had to go home to deal with whatever is there. So I guess for me, I agree with all the pluses and why kids are doing well, but I'm also, you know, we're also ever mindful of the stresses that kids continue to have that are kind of jumping right in front of their laptops. They're there right as they open their eyes. That stress is there. And sometimes, you know, it's magnified as some of our families, you know, their living situations change. And so we now have two whole families living in the house, and we're all trying to get our homework done. We don't have enough internet services to quite support everybody that's trying to do their schoolwork. We have 2 laptops for students. And so not that I'm glass half empty by any means, I'm always on the plus, but just being mindful that yes, there's some kids doing well, but those that aren't, the struggle is absolutely real and is right in their faces as soon as they wake up.
Well, with that, thank you to our incredible panelists. I'll just repeat what someone just messaged me. Seriously, amazing humans. So thank you for all you do, who you are, your whole self. So thank you for joining us this evening. I'm going to turn it over to Director Scott, who I believe will close us out.
I did want to just ask, I know that Director Brim-Edwards had a question for Chris Minnick, and I wondered if we wanted to get that in really quickly.
I do. And thank you. Is Chris still with us?
Yep, here. Thank you.
Okay, great. I also took advantage of David Roy's suggestion to submit about 10 questions that the community had submitted into the pps.net comment page. So everybody who's texting me questions right now, submit your questions there. But my question for Chris is, you had a lot of data in that deck about 4 million students. And I was surprised that the learning loss wasn't greater. I think it just surprised me. I think like a cautionary note was that none of the data reflect PPS students, and that there's a missing 20%. And in your presentation, it indicated that those missing students were more likely to be ethnically and racially diverse and students with lower achievement in fall of 2019. So my 2 questions, one is for Chris and one is for staff. The one for Chris would be, how would you suggest that PPS assess the effectiveness, since they're not part of the data set you presented tonight? How would you suggest that PPS assess the effectiveness of comprehensive distance learning? And the second, for PPS staff, do you have any disaggregated data on how CDL, or comprehensive distance learning, how effective it is? And what learnings would you take going forward if we're seeing learning loss?
Great. It's a big question and probably more than 1 minute, but I'll just be real quick. I mean, I think the first thing is you need to do some set of assessments to understand where kids are, but you don't need to do massive amounts of testing. So like, I just feel like there's a sweet spot that we haven't quite hit in our local community here about getting enough data to know what's going on with kids. And if we obviously have the MAP assessment, we think that's important, but there are ways to gather data. So whether it be in the winter or in the spring, there's ways to make sure we're doing just the right amount of assessment, not too much, not where we're testing kids all the time, but there does need to be some set of assessments that show us some set of data. And I think I would, on comprehensive distance learning, we'd actually be very happy to partner with the district if there was an ongoing conversation about how we might look at that. So superintendent, if we want to have a follow-up conversation about that, we'd be happy to do that. Thank you.
Great, thank you, Chris. Yep. Does PPS staff have I don't know if that's Dr. Bird or Dr. Brown. One of the doctors.
If they're
going
to go ahead.
I think Mr. Minnick stated very well that we certainly see and share the need for some assessment data to be able to anchor this conversation. And then, with I think a census assessment window at some point in this spring to be able to help us anchor and understand the impacts of CDL and where it's worked and where it hasn't, I think would be very, very helpful. And of course, we'd be more than happy to tap into the expertise of the research team of NWA to extend the capacity of our work to be able to lead into that. Thank you.
Thanks.
I think, Dr. Brown, that's such a critical point that you just made about, and Mr. Minnick as well, about what is the sweet spot for getting just some information about where our kids are, because we're struggling now at the beginning of our budget process with knowing how we're going to allocate resources for next year and knowing that we're going to have to do things differently. We're going to have to respond to the learning loss that we know has occurred. We know it's greater than what you presented to us because that was just from last spring. None of that takes into account any of the learning loss from distance learning this whole fall. And so it puts us in a really difficult position in terms of creating our district budget because we need to double down on interventions for our kids who have fallen far behind. But we have to have some way to gauge, how extreme is that loss and what are the interventions that we're going to have to put in place and how much are they going to cost?
Great. So I'll just go ahead and wrap up. We're a few minutes over, but it was such a valuable conversation. I just want to say thanks to the amazing panelists. We heard from public health professionals. I have to say that data presentation on COVID was one of the clearest I've seen, and I've been reading a lot of data on COVID, but it was very clear and great. We heard from teachers and parents and from students and community partners. We heard about the impact on learning, and which, as was just mentioned by a couple directors, it may not be as bad as the worst case. We know it's having a negative impact and it is exacerbating the achievement gap. And so keeping an eye on that is going to be really important. We heard about the health impacts that COVID is having on our community, that it has been having and continues to have as it sort of ravages through and the numbers go up. We heard about specific experiences and challenges that students and parents and teachers are having. And we heard, most importantly, about the need to make sure we are hearing from everyone, and especially the Black and Brown families and students in our district who we know are disproportionately impacted by COVID, and we know we're not hearing from in the same proportion as others. And just making sure we're doubling down on that is really important. And finally, we heard about the need to make sure we come out of this pandemic and this crisis with more equitable structures in place, so we don't return to the old ways that weren't working. And I think that's one of all these valuable points. That's one of the most valuable ones of the entire night. And finally, I think someone said earlier in the first panel that we can all agree on is that everyone wants to get schools open again as soon as it's safe to do so. And really the hard question is finding that balance. So there's going to be a lot more discussion to come on this topic, which is really the most important thing facing schools right now. And I just appreciate all the panelists and folks listening. And I know that we as a board will continue the conversation, as will the community. And in fact, on that note, I will just put in a pitch. I believe there is a session, OHSU, Public Health Portland style. If you are jonesing in the subject as much as the rest of us are, there's going to be a panel on Wednesday, Balancing Risks and Benefits of School Closures and Reopenings During COVID-19. Our very own Director Constam is one of the panelists, along with Colt Gill from the Oregon Department of Education and other people as well. So continue conversation on Wednesday as well, and you can register for that event free on the web. So with that, I think we'll close it out. Chair Lowry, anything else?
I think that's everything. I want to thank again all of the panelists for your time, especially our panelists who are on the East Coast. I know it's very late for you. Once again, every time we do this, I am so impressed with the teachers we have in PPS, the parents, our community partners like SEI, and of course our student leaders. So we have a long road ahead of us and a lot of work to do, but we have amazing partners and amazing voices, and we are very, very fortunate to have students like Lana and all of the experts and the adults working together to do what is best for all of our students. So thank you all very much. And to our amazing staff who pulled this together, especially our board manager, Roseanne Powell, who took the board's request for something like this and worked with the team to make it happen. Thank you so much. And as always, thanks to Terry for broadcasting us and for our 2 ASL interpreters tonight that helped make sure that there was some additional access to this meeting. Thanks, everyone. Good night.
Thanks so
and
much, everybody. Good night.
Thanks, everybody.
We'll see you all back at the board meeting tomorrow.
Thank you. Good night.